The apartment is silent, except for the soft hum of the refrigerator. Jake, 27, stares at his laptop screen, but the words don't make sense. He blinks, his vision unfocused, his mind drifting again. It's been like this for months. Since the world went back to normal, he hasn't felt normal at all. He used to be outgoing, the guy who planned weekend trips, laughed the loudest in the bar, thrived in crowds. But now, even stepping outside feels like a battle. The thought of socializing exhausts him. His chest tightens in grocery store lines. His hands sweat when his phone rings. Some nights, he lies awake, staring at the ceiling, his mind replaying memories from isolation, empty streets, the constant hum of the news, the weight of uncertainty pressing on his chest. He thought things would get better when the lockdowns ended. Instead, they got worse. The breakdown happens at work. A simple meeting, a routine discussion, and suddenly his heartbeat is racing. The room feels too small. Words blur together. His boss calls his name once, then twice. He doesn't answer. His breathing is ragged. He stumbles out, locking himself in the bathroom, gripping the sink as he gasps for air. Panic attack. Again. At home, his sister Samantha watches him with growing concern. "Jake, you need help," she says softly. He shakes his head, forcing a smile. "I'm fine." But he isn't. Days later, he finds himself sitting in Dr. Alvarez's office, his foot tapping nervously against the floor. The therapist watches him, patient and calm. "Tell me what's been going on." Jake exhales, staring at the floor. "I don't know. Ever since the pandemic, it's like, I don't know how to be around people anymore. I can't focus. I feel tired all the time. And some days, I just don't see the point in anything." His voice cracks at the last sentence, and he hates himself for it. Dr. Alvarez nods. "You're not alone in this. Anxiety, depression, PTSD. Mental health issues have skyrocketed since the pandemic. The isolation, the uncertainty, the constant fear, it left scars, even if we don't see them." Jake swallows hard. "But everyone else seems fine. Why am I still stuck?" Dr. Alvarez leans forward. Because healing isn't instant. The brain doesn't just move on. It processes trauma in its own time. And right now, your mind is still in survival mode. The sessions continue. Cognitive behavioral therapy, CBT, to challenge the negative thoughts looping in his head. Breathing techniques to stop the panic before it spirals. Medication discussions, if needed. Slowly, he starts rebuilding. A short walk, a phone call, a coffee shop visit without the crushing need to escape. It's slow. Some days, he still struggles. But for the first time now, he sees a way forward.